Hello everybody, Dr. Justin McCormick here. Today I'd like to talk about why we use oxygen in our clinics. Now your brain needs two things to survive, fuel and activation. That fuel comes in the form of glucose and oxygen. Now I'll talk about that glucose at another time, but today I want to talk about oxygen. Your brain, and particularly your cerebellum, which is the back portion of the brain, are the most oxygen-dependent portions of your body. Your cerebellum controls your balance, your coordinated movements, and all of your posture, stabilize your muscles. So all of the muscles that you feel in your back, in your neck, your lower back, all those are under the control of the cerebellum. So if that cerebellum is misfiring or not firing properly, what's going to happen is your back muscles are going to tighten up. When that happens, the joints tighten up and it actually will dry out your discs. And this can cause things like slipped, herniated, bulging discs, which we also treat, but that's for a later time. So it will dry out those discs. When you get that oxygen into the body, all of a sudden though, that cerebellum can start functioning and firing more properly, more normally. It'll relax those postural muscles, elongate those spinal joints again, and allow your discs to start functioning normally again. Most people, or should I say an asymptomatic person, somebody that's not suffering from fibromyalgia or chronic pain, they'll get that oxygen into the body through their normal daily routine, through exercise and activities. Now, almost every single fibromyalgia patient that I've ever seen tells me their doctor says they just need to exercise more or they need to do more activities. Well, in theory, I can understand that because it does make sense from a doctor and clinician's perspective, but in actuality, that is not realistic. And I believe you guys when you say, I just can't do that, because I see these chronic pain patients every day, day in and day out, and they have a hard time walking into my office, let alone say go for a jog. It's just not going to happen. So we use oxygen to help supplement what you cannot do with your activities and daily exercise. So we start by simply having the person with lasers. We deliver that to different areas of the nervous system, and also using oxygen to drive in 90 to 95% pure oxygen. So the person's just resting on an oxygen concentrator and getting their brain the fuel that it needs to start functioning normal. Now, once that person starts having some degree of normalcy, they start firing, that brain starts firing better at a more normal rate, then we'll start adding what we call an upper body ergometer. Basically a UBE, upper body ergometer, is like an upper body exercise unit. So they're on the oxygen, we have the lasers going into the nervous system so it starts functioning normally again, and this person's using this upper body ergometer. And what happens is it starts actually driving the pressure of that oxygen into what we call a capillary. That's a portion of the cardiovascular system that carries that blood and oxygen into the brain, so it starts actually functioning and firing at a normal rate. Once that happens, amazing things start going on. The person has more concentration. The patient will have better energy. They'll have better focus. We'll actually see depression decrease, anxiety decrease. Their immune system will start functioning at so much higher normal rate, they're actually happier people. So these are the things that we see with oxygen. This is why we use it. I hope this helps you guys, and go to our website. You can learn more about it. I really hope to hear from you guys soon. Thank you so much.